conversation, so feel free to get up and grab drinks, grab snacks as we talk here today. But welcome to the 2025 DSC Gimme Shelter event. You are at the program Spotlight tonight, which precedes the real entertainment later, the Gimme Shelter concert, which I hope you're all able to stick around for. But for the next 45, 50 minutes or so, you're going to hear from us talking about one of our new programs here at DSC, talking a bit about the rationale behind the program development, the story about how we got here, and what we're trying to accomplish and how it fits into the larger suite of work and continuum of services DESC provides. So I'm Noah Fay. I'm the Senior Housing Director at DESC, and I am here to talk about DESC's Star Center. So this is a story of a program that evolved out of a response to the pandemic, a response to the COVID crisis, lessons learned about how services can be delivered and delivered better, and ways to improve the kind of care we deliver to our folks at DSC. We're going to talk mostly about the Star Center, but we're also going to focus a fair amount tonight, or reference tonight, some of the other programs that Star Center is situated amongst, including the DSC's Orca Center and the Downtown Behavioral Healthcare Clinic, which also features our drop-in center as a way to kind of highlight some of the elements of the continuum of services that we attempt to provide the highly vulnerable population that DSC serves. So these programs don't sit in isolation. They're meant to be part of a continuum of services to deliver care. And that, I think, is the key take-home message of the Star Center conversation. We'll talk a bit about this as we go throughout and try to highlight what we think is really innovative here. But the take-home high-level theme is that the way our continuum of services have largely worked for a long period of time is, whether at DSC or other aspects of services in our community, do really great work providing crisis outreach or providing outreach to people with really severe and persistent behavioral health and mental health conditions. But those aren't necessarily tied to available shelter resources or resources for people to go immediately or get a quick respite and the needed survival services. Those services are often disconnected. Those are further disconnected from the available permanent supportive housing and housing resources that DSC specializes in and are largely the key for the very folks we're trying to serve. And the story of the Star Center is an effort at trying to take lessons learned from the pandemic and the way to deliver shelter, the way to prioritize care to some of the most vulnerable people in our community, and align all of those things. It's still very much a work in progress, but we want to talk to you about where we're at in that journey. To that end, on your chairs, you have a pamphlet that has quite a bit of great information in it, including a kind of a visual chart that's meant to represent some of that journey. Jimmy's Journey is the name of the image graph in your pamphlet that highlights theoretically how we'd like to see these services align. And I want to acknowledge that we work with folks, and that's true for everybody, that journey's often not as linear as it shows up in that picture, but yet we still want to make sure we're aligning those services in a way that creates an intentional through line. So that's what we hope to cover with you today, and welcome. Okay, I want to do some brief introductions. I am joined tonight by two esteemed colleagues here tonight. I have Director of Human Services at the City of Seattle, Tanya Kim. My colleague Taralynn Carter, who is the project manager of the Star Center, starting on Monday morning. Taralyn's been working at DSC in many capacities for quite some time before that. Both are super key leaders in doing this work, designing this work, delivering care to people in these hyper-specialized ways that we're going to talk to you about tonight. As is custom, DSC likes to do a land acknowledgement before we do launch into the content and the program tonight, and so I'm going to read to you that right now. DSC occupies the indigenous land of Coast Salish peoples. We ask you to join us in acknowledging their community, their elders, both past and present, as well as future generations. DSC also acknowledges that many indigenous peoples from near and far were dislocated from their lands and cultural practices, resulting in many hardships, including homelessness. We honor all Coast Salish and other indigenous people and are committed to learning and identifying DESC's role in undoing harm. Thank you. Okay. In order to give you the context for why we think the Star Center is so innovative and important, we need to do a little bit of the Wayback Machine and talk about how we got here and how our system has worked over the years. Shelter in Seattle has historically not been focused on serving people with the greatest needs. It's not been particularly conducive to people with really profound mental illness, struggling with substance use issues, or setting up physical locations such that people have the best chance possible to recover and have a sense of stability. That includes our own programming. I've been at DSC, I have the privilege of having worked here for 21 years, and I got my start in our shelter program. That program is deeply meaningful to me. I think we saved countless upon countless of lives by offering that program, bringing people, have an accessible space to bring people in off the streets. I will be the first to acknowledge that was a tough, tough place to live. And that's what many people did, was live there. It's a very, as you see, very crowded environment that was not necessarily conducive to giving people the safe, stable platform necessary to access the kind of care that people may need to recover. So that's a little bit of the water we were swimming in. We've been moving as a community and as an organization away from a model that really prioritized as much quantity as possible to thinking about how can we design programs with slightly maybe less quantity, but maybe a higher degree of quality of space so people had a better chance to access care and have some stability. And then the pandemic hit, and we were forced to make some pretty dramatic changes, which is where I want to offer Tanya to talk a bit about your role and what you have seen in the evolution of shelter since the upheaval that was the pandemic.
Thank you. I am a wildly introverted individual. I flex in my role as the director of the Human Services Department, and so I just love that Noah did that introduction because I think you covered literally most of my speaking points, and so thank you for that. And so I get to sit back a little bit and really just speak off the cuff and from my experience, and so I've been doing this work at the city for 15 years, and I think a month. LinkedIn tells me 15 years and a month. And I have done everything from working on contracts to managing youth employment. I worked in our aging and disability services. I've worked in different spaces within our department, and I love the work. And I say all of that because I am not a subject matter expert in working with our unsheltered populations, but I became more knowledgeable, and I know how to gravitate towards the smart people who know how to do the work. And that's what's really important about kind of the role of the city, is really leveraging the expertise that's in the community and listening to what has worked, doing more of that, and being open to change. And I think that you will often hear our mayor talk about being a learning environment. And it's easy to say, but when you're in a public entity, sometimes you don't want to take the risk and do something different in the case that it could fail, or in the case that we don't deliver on the things that set the expectation. What I love about the growth, remember the pandemic? It really taught us how to think differently, and we learned quickly, literally the next day, to be different. And I would say with the relationship between the county, and I have to give a shout out to King County Regional Homelessness Authority, who we provide most of our funding to in the city, to work with organizations like DESC to do things like the Star Center. I mean, truly it was because we saw the difference that it made. And now I will just share that because of some of the promises, we are already committing to doing more models like this. And that's very exciting. And so we're moving from the idea stage to implementation to really committing and making this a learning opportunity, but doing more of it because we see that it's starting to work and that we know that it will work. So that's my perspective. Thank you for saying all the critical things though in the introduction. I really appreciate it.
Yeah, I'm always good for some critical stuff. Thank you very much for that. I appreciate that. We were swimming in some really difficult waters, and I think we work in an industry that responds really well to crisis. That is actually kind of our state of being, as we live in crisis, and so we respond quickly. But how do we take those lessons learned and extrapolate them out and deliver service and improve the way we do work. That's not as always as easy to do, to your point, that it can be hard to make change, especially large scale change. And I think some of the lessons learned about how services were impacted during the pandemic really informed a lot of that. So Taralynn, I don't know if you'd speak from your experience at the drop-in center, maybe a little about the drop-in center and what you saw.
So I've been, and folks who know me know I have a really soft spot in my heart for the drop-in center. I have been the supervisor at the drop-in center for about 3 years. I'm transitioning into the PM role now, but that's where I've been for the past 3 years. And the drop-in center was this really unique thing. So first thing maybe to know is that the drop-in center is one of the longest running centers of its kind. It's been continuously operating since 1994. It is a peer-run, peer-led space. It's a space that people can go to spend their day, to access hygiene services. There's access to food in that space. For many of the folks we serve, it is the only space that they are welcome to be in and feel welcome to be in. And I think that's a pretty incredible thing. And that was also really unique during COVID because as we saw so many other resources across the downtown and Pioneer Square landscape and of course across Seattle in general, we stayed open and the way we served people looked a little bit different. Our front doors were closed and we were meeting people on the streets and providing services there and also then bringing folks inside. We had limited numbers, but from the beginning of COVID to the end, we continued to run a drop-in center, continued to welcome people into that space. And there were some challenges associated with that. I'm really incredibly proud of the work that people did to ensure that it kept operating during that time. And when we saw other programs no longer serving, we did things like opened up hot food service again, expanded outreach and case management programs in that space, continued to see the expansion of our opioid treatment network team in that space. But it became increasingly clear that there was still just a lack of other supportive behavioral health services in the downtown landscape. The drop-in center was in many respects sort of an island downtown. And while we were able to serve folks during the day, there was not a place for them to spend their nights, and those clinical connections are increasingly tenuous when folks are only able to access them during our 9 to 1 or 9 to 5 daylight hours. And the drop-in center actually is expanding its hours. So historically it's been open 9 a.m. to 1 p.m. We have started opening 9 a.m. to 2, and starting Monday we will be open 9 a.m. to 3 p.m. So we have longer drop-in hours than we have ever seen before. We are now operating out of the new Downtown Behavioral Health Clinic, which is a more integrated landscape that has the ORCA Center, the Overdose Recovery and Care Access Center. We continue to see an expansion in our nursing services in that space, but the thing that hadn't returned to the downtown landscape was really a shelter space and one that had the integrated behavioral health care that people need. And that is, I think, the space that STAR is stepping into.
Yeah, thank you, Taralynn and Director Kim. Exactly, so picking up in parallel to the story that Taralynn just said about the drop-in center during the pandemic, the pictures I showed earlier of those large congregate shelters we were operating right up until the stay-at-home and social distance orders came, where we were told everyone needs to go home and stay away from each other. And let's see, go back to this. How possible is that in an environment like that? We've got 230 people that don't have a home to go to and just by definition can't get away from one another and socially distance. So that crisis opportunity allowed us to rethink our shelter space and design or take up opportunity to literally overnight move into non-congregate facilities, as we now coin them. We're talking about hotels, to put it in more common parlance. And truly overnight, folks that we had known for decades, staff used the words unrecognizable to us in terms of how they were able to make kind of more traditional change around starting to engage in care that might have been hard to access, start working with doctors that were available, but when you're worried about where your next meal is coming from, where you're going to store your stuff in a line of 200 other people trying to get a meal proved to be too difficult. We saw things organically crop up that people started exercise groups, which is just unheard of in a space like a crowded group like that. And so we were really quite happy with the results we were seeing. I won't bore you with the details. As the pandemic unfolded, we were able to sustain this model long term. So we permanently replaced that large non-congregate space with a model that provides people the safe, stable platform of more privacy, a door you can lock moving forward. And we're able to do that after not just using our anecdotal experience of observing just folks who have a lot of experience running these programs, hearing directly from the clients that we served in these programs for long periods of time how much better this dynamic was, which I want to acknowledge shouldn't be surprising to anybody. I mean, it's kind of the core to the housing first orientation. It's the first thing you do is you remove the chaos of homelessness, give people a safe, stable platform. That gives folks a fighting chance to actually engage in the care they need. Duh, that's the model of our work. Doing that in a shelter, it only makes sense. I will say we were surprised with just how fast that change happened for folks. And so we wanted to get some further corroboration that this model made sense, and we were very lucky. The University of Washington expressed interest in studying the outcomes of these models. We weren't the only provider to do this during the pandemic, and what you see on the screen here is some of the outcomes of a study done by the University of Washington later in 2020 of the effects of these programs. And we saw things about people reporting a much higher degree, a sense of safety and the ability to do future planning that they said they weren't able to do in a high stress environment where night after night they're worried about getting their basic needs met. That safe, stable platform allowed people to engage in care that previously had just been unavailable to them, not because it wasn't there, but they were in a space that made it hard to access. This changed that. However, there were trade-offs. One thing we saw with this model, and Taralynn alluded to this quite well, was that because it was such a more stable environment, we had less turnover and churn of people through the program. Those old, large congregate spaces invariably had openings night after night. They got filled every single night. They were always at capacity. But people would leave for various reasons, I think largely because of the stressful nature of the congregate, high-intense environment, which is not what we want. But the positive flip side of that was that somebody who was at the emergency room, someone could call the shelter, social worker could call the shelter, and they'd have a place to go that night. Or an outreach worker, which is what I did earlier in my career. I'd work with somebody on the streets, try to build trust and relationship, and one of the most important things I could offer somebody was a place to go. Because these models are so much better for people and they were able to engage with them and leverage the space, we didn't have turnover in the beds, so we didn't have the availability to move people in. So we got to thinking, how do we strike a balance between these two things? How do we not sacrifice the quality of the programming, the physical space from the lessons learned during the pandemic, but ensure we're doing everything we can for the highest needs folks, our particular target clientele, to be able to have a space to go so we can make services like the drop-in center, like the crisis work that happens in our community, like the outreach work that happens in our community, more effective by pairing it with a place for people to go. Which I think brings me, Director Kim, to some of the work we started doing together on planning for what became the Star Center.
That's right, and what I love about this photo is it's all that planning work. We were meeting weekly at one point.
Weekly in person.
It was mandatory in person.
People with some very busy schedules.
And we had chiefs, we had directors, we had folks from the mayor's office, and it's not to say that we didn't have other things to do, but we made it a priority. And so what you heard Noah talking about, all the critical things, but when Daniel and Noah and others came and they had the research, they had the plan, what they needed was the resources, and they needed the various city departments as well as the county folks too, to come together and help realize this so it was not only successful to launch, but successful for the sustainability. And when I see these photos, actually, I think you were one of the speakers at the opening. I remember because I thought, how is she off, not looking at a script and reciting such a beautiful, it was one of the best speeches, so I remember, but it comes together. It came together after a lot of hard work, and I'll tell you, when you have a gem like the Star Center, there are some disagreements. I mean, we were talking about security and what that looks like beforehand, and are they armed, are they not armed, who's gonna pay for that, what are the expenses, what are the hours. We talked about making improvements with the facility, so the fire chief was really good at even offering some technical fixes that might help prevent future issues. We were leaning in, and I think that, again, as somebody who isn't traditionally in the space, I think maybe that was useful because it was more of how can we do this and how can we get it done? And we were putting our money where our commitment was too. So we didn't put the burden on you. You said, if you want us to be successful, this is what it's gonna look like. And it was an easy way for us to say yes.
Yeah, I want to give credit where credit is due. This was the story of developing and designing this program, of which we'll talk a bit more about the details of what the program ended up looking like as we keep going. But the level of alignment and partnership across the three essential government entities, and to your point, the police and fire, was unprecedented in my career, and I think it spoke to that there was a high degree of alignment and investment in the interest behind seeing this need of highly vulnerable, unsheltered folks needing a place to go, but not just a place to go that wraps them in the care they need, so that all the other investments in our community, whether it be outreach or crisis response or what have you, are maximally effective. And if we can align those things, we're not only good stewards of public resource, but we're going to see a benefit for the people we all want to serve and our communities as a whole. And that buy-in was there in the early days, and it showed as we really came together and solved some maybe boring problems in terms of codes and permits, but we were able to just knock through some stuff and get a lot of complex stuff solved so we get this program online. Taralynn, I'd be interested if you talk a little bit about some of the on-the-ground services, client service delivery that we were aiming to solve for with the Star Center.
Yeah. So we were really trying to fill that gap, I think. We had some services during the day, we had folks that were staying in non-congregate shelters, but we were really seeing a lot of folks continue to fall through the cracks. Folks who maybe had existing clinical connections, but they were really tenuous clinical service connections. Folks who were extremely disorganized or difficult to engage with traditional service models. Folks that we might see on a bit of a revolving door. We would see them for a month or two, establish some service connection, and then because living unsheltered is very, very difficult, trying to meet your basic needs is really challenging and requires accessing so many different spaces and places, moving all over the city to get your basic needs met. When you combine that with folks experiencing complex disorders, it meant that despite having those services available in the daytime, we were just still seeing folks falling through the cracks, right? When they were trying to meet their needs in the afternoon and the nighttime, and then we wouldn't see them again for a while. And so all that work that went into, and I say work on the part of our clinicians and our care teams, but also the work that those clients were doing. It is really hard to survive what the folks we serve are surviving. So all the work that those clients were putting in, trying to make progress in treatment, in finding shelter and housing, we were doing that over and over again, right? And that is exhausting, and also in terms of how we're using our resources as an agency and across the city, like that is not the best model for service and not the best use of our resources. What the Star Center does is create this really unique hub where people can receive services. And now we have these two hubs in Pioneer Square. We have the drop-in center where people are able to access services throughout the day, including mood medication for opioid use disorder. Folks are accessing nursing services there, case management services. They have a place to be during the day. But now with the Star Center, we are able to capture people who previously were falling through the cracks and deepen those service connections. It creates a really interesting window of opportunity for people where they have, it's meant to be 90 days where case management is right there, in-house. The place they're spending their days is right down the block. Folks are able to get treatment services, to see a psychiatrist, to get RN services entirely in-house at the Star Center, without leaving what is already their established community. And sometimes it's a bit of a misnomer when we think about folks who are unsheltered, that they don't belong to a community, that homelessness means community lack. And the folks who are living unsheltered absolutely are supporting each other and have this incredibly supportive community, this peer support that they are providing to each other. And one of the challenges we were seeing is as we were providing these non-congregate shelter models, folks were traveling to those shelters. That meant maybe they were up in a shelter on like Aurora, maybe near 145th, and those were fantastic compared to our previous congregate shelter models. But in practicality, it took some already very vulnerable folks really far away from where they were receiving treatment. And by creating STAR as this second hub to pair with the downtown clinic, we created a space where people are able to access the full range of services entirely within the space where they had established community and connection, and that alone is keeping people in that space. People can continue to access their community, continue to receive that peer support, and now also have a shelter where their case managers, their support teams can consistently provide that support to them. And that sort of hub was not something, to my knowledge, that existed previously in the social service landscape here in Seattle. So that's an incredibly unique development and an opportunity for us to deepen those connections and create really meaningful progress in a very short amount of time. And that just wasn't possible for us before.
Yeah, thank you for that. And building off that, I would say, I think one of the stories of the STAR Center and how it fits into this continuum here is really a story about how we can promote continuous improvements. I think there's long kind of a sense in our world that we do shelter a certain way, we do outreach a certain way, we do housing a certain way, and that's just how things move forward. This is a story of identifying where there are gaps, how things can be done better, and then trying to align those things. Some of the stories that I heard is, and that's what this graphic is meant to highlight here, is our different networks, including internally at DSC, for reasons that are not necessarily totally up to us, but required the government partnership that allowed us to bring some of these things together. Our outreach teams didn't have access to programs that specialized in serving the populations they were outreaching. Our permanent supportive housing programs that are dedicated to working with people with really profound long-term issues that need those embedded supports don't necessarily have a pathway for finding those people who need to move in, who have those sorts of needs. The STAR Center is an effort at trying to align those things that historically have largely been out of disalignment in our community. And one of the things that I've heard and have been really heartened to hear, this program only opened in March. We are still in the early days. We are still iterating, but I was really happy to hear from a case manager who works for one of our outpatient behavioral healthcare teams express a deep gratitude about the ability to have the person she was working with at the STAR Center, where she said, before, I was spending my day doing the best I could, delivering care to him, trying to find him in the community, trying to connect him to a shelter that barely didn't meet his needs and he couldn't stay, and then chasing him down to try to help connect him with meds. He'd try to find me, but I was busy at the moment, then he'd leave, and it was just kind of two ships passing in the night, and the stars had to align for the high quality care to be effective. And that creates a sense of moral injury for our staff, not to mention our services aren't as effective. By aligning that, we're able to make the quality of the outpatient care, the quality of the outreach work we do that much better, and ideally, the outcomes for our folks end up looking that much better too. So a little bit about what this actually looks like on the ground, some details here that I could get into at length, but won't, because that's a little inside baseball maybe for this conversation. But what makes this different than traditional shelter models is anyone can be referred into this program, but we give special priority to people who have profound mental health needs primarily, but any behavioral health care needs, who are loosely connected to that care, not connected to that care, or all of a sudden, I'm so glad you used the term window of opportunity, have a window of opportunity to make a stay at the shelter be that much more impactful, to make those behavioral health care services stick and be as effective as possible. So looking back on my old outreach days and a lifetime ago, I'd be working with somebody trying to build trust, break down all the barriers to care. I might have a breakthrough where somebody's willing to engage with me, whereas before they weren't able to. And we could now strike when the iron's hot, get somebody into the STAR Center and wrap them in care, whereas before we'd just be hoping we could be able to continue to deliver that care on the streets to maybe minimal effect. The ability to align that is really profound. So that's unique. There's not a dedicated there's not a shelter system that has a dedicated pathway like that. We also are intentionally wrapping people in behavioral health care in this program. So what that really looks like is people are able to access mental health care by virtue of being in the shelter space. That is not how shelter has historically worked. Shelter and behavioral health care services are two separate entities. They may literally have been across the street for decades in the case of DSC and managed by the same organization, but they're run by two discrete systems. While that's still technically the case that they're different systems, the willingness for the Human Services Department and other partners to see the value in investing in what might otherwise be seen as behavioral health care resources to embed in the shelter, to leverage the effectiveness of other behavioral health care resources, has allowed us to have a dedicated psychiatric provider work in the program. So somebody can get restarted on medications in that program, whereas historically you'd have to reconnect with a doctor, find an appointment, all while looking for a place to stay. Those sorts of barriers are broken down and streamlined in a model like this. We referenced Orca a little bit earlier, another example of how we're trying to leverage shelter to make behavioral health care more effective. The Orca Center, as we've talked about briefly across the street, people are staying for up to 23 hours, getting post-overdose care, stabilization on medication for opioid use disorder. The ability for the Orca Center, they have a dedicated pathway to be able to refer people directly into the STAR Center, meaning those 23 very valuable hours are maximally effective because now somebody, if they need it, not everyone does, has a place to go across the street where that care can continue by providing ongoing follow-up, connection to services, referrals to outpatient care, what have you. Which might sound simple, but that stuff historically has been largely unaligned. And by bringing this together, we suspect to see much better outcomes for the folks we're serving. Okay. I didn't have a grand way to end that narrative about the program as you see. I was kind of hoping a plane would fly over right as I did that, which would be a message to tell me to land the plane and end the narrative, but that didn't happen, so.
Can I underscore something that you said? It's really interesting to me because what you describe sounds almost like, of course, we should be doing this. But it didn't exist, and it just makes me think about if we think about the person. I'm sure many of us have either lived experience or know somebody who's been in crisis. I could think about my own son, who himself has overdosed several times and has been hospitalized, who has struggled with getting appointments and has a roof over his head, and I was helping him navigate all these different things. When you don't have that safety net, and when you don't, when there are these barriers put up, it could really be something as so simple where then you don't take that next step where you're unsafe. And what you're describing is an organization and a whole program and a whole system. It expands it where you can serve hundreds of people in a way that allows folks to move through their own recovery in a way that sets them up for success. And so I know that we're talking about a program where I represent a city government and you're with an organization that we love, but when you think about the impact that it makes on people, it's very profound. We're just talking about it, but the impact on people, I could see where, that's my son that you're talking about, or that's my, that's our neighbor. And so I guess I just want to underscore how important it is. It's easy to talk about, but the real impact is just so moving. And I really appreciate you and all of the colleagues at DSC. I know that there's several staff here, maybe up in the staff room too, but it's just remarkable. So I know we're gonna go and party, but I do want to pause and just really reflect on how powerful that is. That's so important. So thank you so much for what you're doing and allowing us to be a part of the journey and allowing us, the city, to support the effort.
Yeah, thank you so much. Yeah, that's how we let it be. Thank you. I appreciate that. You saying that very much. That touched me. Thank you. We have time if there are questions from the audience. These are meant to be prompts. If you didn't want to ask a question but didn't actually have a question, feel free to pick from that list. But otherwise, the floor is open. Anybody have anything they'd like to pick our brains about? Sure.
I was just wondering how many clients or individuals you could have in the STAR Center.
Yep, great question. We have 75 to 85 beds, and that number is a little malleable because we are trying to meet individual needs, and we are serving some folks who sharing a space, because there's typically 2 beds to a room in the Star Center, and sometimes that is not the best way to meet folks' needs, right? So there is some variability in whether we have 1 or 2 people in a room, but we have maximum 85 people at the Star Center.
The demand, which didn't surprise anybody, has been through the roof. So we've had over 1,000 referrals since we started taking them in late March. So fully acknowledging this is one piece of an overwhelming demand in our system, and that sort of referral demand speaks to that.
I really like to refer to this as an incubator project. My sincere hope is that with the success of this program, with this collaboration and these partnerships that we are having across so many departments and teams, that it really demonstrates the impact that a place like this can have. And we talk about this in terms of improved outcomes, right? We see people engaging with recovery, and those are just really abstract ways of describing it. Like, of course, that's how we describe it in clinical terms, but I really want to put a human face on that, what it means to be successful, to improve outcomes. That means that a person lives to see another day, another week, another year where they can make choices for themselves. It means that we are seeing more connections to long-term shelter and long-term housing. It is incredibly difficult for folks with complex disorders to jump through all the hoops and complete all of the necessary steps to obtain long-term housing. If anyone in this room, myself included, tried to do that, it is an incredibly difficult process without the component of complex mental illness added to it. And this program means more successful connections for people with all of those challenges, obtaining long-term housing, obtaining long-term success in their treatment of mental illness. It means, especially when we talk about the Orca Center and the way we have the ability to have folks go from the Orca Center and have a 5-day stay at the Star Center, what that means for folks is that they are able to maintain treatment and medication access for long enough to stabilize that they may continue to engage with that treatment, not just for that 5 days, but for months, for years, possibly forever. And that is really incredible because we lose so many folks in treatment in that space between the first day and how do I create stability in the next week or the next month. So really being able to bridge that gap means that success looks like people surviving, people continuing in treatment, people's mental health stabilizing, and more successful connections to long-term housing.
And if I could just add from the city perspective, that's a really good question about the capacity and, you know, the weight. Such a good question that we got excited. But we have, I'm sure you've heard this, but many first responders, one of the most frustrating things that our first responders are saying is that where can they take people? And where can they take people that have a meaning? And so some of the pictures earlier was really focusing on our fire department even before it opened, or our care department or SPD colleagues to go and take a tour because they wanted to make sure that they could speak firsthand to the experience that they're going to be supporting people to go into. And so that was really important. So we were very intentional, but they are one of the primary referral sources, our first responders.
A few.
I have a
Right
question.
here.
So there are a lot of DESC shelters throughout the city, and I was under the impression that all of them had wraparound services. Is that not true?
No, that's a great question. The question was, there are lots of DSC shelters. There's 5 versions of things that I think we classify as a shelter type environment, and all of them have intense services. Not all of them have, none of the other shelter that I'm aware of has dedicated behavioral health resources embedded into the shelter like this. Like, for example, I didn't mention, there's dedicated outreach capacity from this shelter. So if we are serving the population we're looking to serve, we're working with folks who may struggle to show up when their appointment is scheduled, they may leave their shelter, we may need to do work in the community to engage them. Historically and currently at other shelter models, the shelter kind of ends at the front door to some degree. If somebody leaves, we don't have capacity dedicated to go try to re-engage them in the community. We do in a program like this. So the difference here is not that this has got deep wraparound services, it's got dedicated behavioral health services to formally connect people to behavioral health care. So it's a difference with a meaningful distinction, but the services, it's an enhancement to, I would say, what the model looks like in other programs that we haven't been able to offer before.
So some people who live in a shelter on 145th and Aurora go all the way down there to the Star Center for help? Did you say that?
No, so people are in other shelters. There's embedded dedicated case management that are doing all sorts of things to help people connect to care, but that is through referrals and connecting with appointments, whether even internally. We do a lot of outreach in those programs, but we don't have dedicated psychiatric time in those programs to help start somebody on medication based out of the shelter the way we do at Star Center.
I also think there's one important piece here. You talked a little bit about how there is dedicated outreach staff at the Star Center. So those services don't end at the door. If we have folks who are disorganized, who are spending more time in the community than they are in the Star Center, maybe they're sleeping there or visiting, but there is dedicated outreach staff at the Star Center so that we are actually going out into the community, continuing that connection, ensuring that people are returning to the Star Center to engage meaningfully with the services provided there. And that capacity is just new and largely because of the collaboration across city departments.
Sandeep, and over here.
So, I guess two quick questions. A quick question, what's the typical stay in the Star Center? I mean, you were saying that with the Orca partnership, it sounds like it's a 5-day opportunity, but what's the typical time to it? And then the second question, I guess, maybe is a little more involved, is how does this intersect the Star Center, given that it's about significant mental illness issues for folks? How does it intersect either with the involuntary commitment system that the city and state have, or the crisis intervention system, crisis care system, the DESC Dearborn facility, or the local crisis teams,
Yep.
or
Great questions.
or the stuff King County's doing now, these crisis. How does it integrate, and how does it work?
For sure. Quickly, so everyone heard, what is the average length of stay? What does that look like, and how does it connect to the larger kind of involuntary and/or crisis system? The length of stay is, we're still learning that. We self-imposed a time limit on the program, which is not how we typically run our programs, not to try to light a fire for people, to try to engage in services they otherwise wouldn't. That's sometimes been a temptation of some shelter programs. We reject that idea. We are consciously trying to ensure there's throughput and maximizing the ability for these outreach teams, these crisis teams, to your next question, have a place to send people. So we're striking a balance on that. We're going to learn how that plays out. The goal is for people to leave to housing destinations. There's not enough housing for that to actually be true for everybody, and so we're gonna play with that and learn. So I think we're still learning. Most people are staying until they find a permanent destination, which is fine. We just also need to make sure we're available to the broader community at the same time. So we're playing with that. How it situates for the larger crisis system, there's not any inherent relationship with the involuntary treatment system, other than it's reasonable to think there could be people in that program that might leverage that more than other programs. To date, I haven't noticed that being particularly unique at the Star Center. That's a relationship that exists at most DSE programs. As it relates to the crisis system, intentionally very much part of the crisis system. So I referenced Orca, I skipped over our mobile crisis team. They have long described the frustration of providing a mobile crisis response and not having many resources to send anybody. They also have some dedicated capacity. So the Orca dynamic, and this crisis team has a special relationship with a short duration stay to try to have more availability. The rest of the program, it's more open-ended. And our Crisis Solutions Center that you referenced, they are actually making quite a few referrals. After people stabilize the Crisis Solutions Center, if folks don't have a place to go, they are looking to make referrals to Star Center too, much like the idea behind Orca is how do we make that time there as beneficial as possible if someone doesn't have a place to go, which historically has been a real dynamic for the Crisis Solutions Center. This helps address some of that, intentionally so. Yes, I think I saw you had a hand up.
It seems like the program is too new to have outcome numbers.
Yeah.
But how are you measuring success?
Wonderful question. The question is, too early for outcome data? Yes, at this point, some early both anecdotes and general take-homes is we're seeing a higher rate of people leaving the housing than we've seen in other shelter programs. We're seeing more people connect to behavioral health care. We're seeing a lot of people come in without behavioral health care and getting it while they're there, but we're plan is to measure those things. We're trying to measure connection to care, reconnection to care. We suspect we'll see lots of people who very well are enrolled in some programs somewhere across the community and have lost touch with it, or it's not meeting their needs for any number of reasons. Are we able to reconnect them to that program or a program that better meets someone's needs? We want to measure that. We want to measure how many people leave to a successful housing destination, those sorts of things. Yeah, great question. Yes?
So I know this is a fundraiser,
It is.
but you've got a connection with the city. Is the city giving money also as part of this partnership, or, yeah?
Is the city giving money? Yes.
Yes, I can confirm.
And since we have a mayoral thing coming up, I'm just wondering how that all works. You know, if there's gonna be any changes.
I am mission focused. And we'll say that we are committed, it's in our proposed budget to maintain our support. We have been supporting DESC in a couple different ways. Capital, directly some capital funds, as well as operating funds. And we have various fund sources. And some of those, without getting too into the weeds, but there's some opioid settlement dollars that we're looking at, some general fund. We have some options. We have historically had some federal dollars. That's a different, we don't have enough time for that right now, but but we are committed. And like I mentioned earlier, we do see a lot of promise here, and so in our proposed budget that is being contemplated, and that occurs every year, so it's not, that's a normal thing regardless of elections. We are, we're gonna double down, and we believe that this is the model, and so we do have a budget item in there so we can expand services like this. There's a really great question about, okay, well, if there are different types of shelters and, wraparound, but I hope that it doesn't get lost that what I heard you say was you want to work with people that usually other folks don't want to work with or aren't able to work with. And that's, so going back to the fundraiser question, a lot of programs don't go there. And that's what STAR is doing, and that's what makes it unique, and we believe that there needs to be more services. Now, it does cost money, but if you want to do it right, you invest, and then there should be a return on that investment, and that's probably, I would imagine, some of the things that you're going to be studying.
Yeah, and thank you to that. I'm taking a look at the time and to the point that this is a fundraiser. I will move us on to wrap this up, and the real fun and song and dance literally comes later. So I just want to end and bring us home here. Thank you so much for listening to us to talk about this program. We are super proud of it, genuinely, and really excited to see more to come in 2026. To Director Kim's point, there's deeper investment coming to expand some of this work at the STAR Center, which we will gladly come brag about later, but there's more to come, and I think the high-level takeaway I want to leave with is the ability to bring stakeholders together around shared interests, about shared community need, is the story of the STAR Center. Our willingness to not be dogmatic and learn about what works, change what doesn't, and be nimble and try to align systems is a really profound way to, as we both hammered home several times, impact care for individual people. Like on the person level, system alignment and engagement really can change outcomes for individual people, and that's not often how we think about it, and I think that's how the STAR Center lives in my mind. So thank you. I want to leave with what you can do to support us, because yes, this is a fundraiser. There are several things you can do to the ominous reference to the federal government. You can champion this work. There's a narrative that this work isn't effective. That is incorrect. And feel free to champion our work and ask us anytime how you can do that if you're so interested. Invite others into that conversation. We welcome and need to engage more people into this conversation. There's a lot of bad information out there. and we need to lean in to engage people about what is actually the truth of the matter. And then lastly, of course, invest in this work, whether with your time, your money, or just your advocacy, or just your voice. So you're doing that tonight, and we deeply appreciate you, and thank you so much for hearing us talk about the Star Center. And enjoy the show.